Clayton? Okay. Okay. Good afternoon, everybody. We now have a quorum, so let's get started, and I'll call this meeting of the House and Human Services Committee to order. Um, We have a couple people visiting. One, Janie Schemenbog will be with us later, and we'll introduce her. But we also have Miss Wheelchair Georgia with us, back over here wearing her crown. I guess that's what we call it. So welcome to the Health Committee. And a couple of people from the police or fire or from Clayton, fire department from Clayton County. They have a great interest in something on one of the bills. They're doing something a little different. Clayton County is a county that doesn't have a lot of medical coverage, and they have started putting APRNs on their ambulances, especially to try to deal with frequent flyers. Those are the people that continually call in with the same medical problems over and over again. So we're having a bill right on another bill that will take care of that. So we're glad to have you two here also. Okay, let's start. We'll just start off. I only see Senator Burke. Senator Kirk, are you? No. Okay. Kirk is not coming. Are you doing? Okay, we got it. He's in another one. Okay, well then, Senator Burke, we'll let you go first. That's with Senate Bill 207. Please come up.
Thank you, Madam Chair. Senate Bill 207, I believe this has a committee sub of LC 337969S. That's what I have. Is that
That's
correct?
right. Does everybody have LC 337969S? Everybody finding it in this pile of bills? Okay, go ahead.
Thank you,
Senator.
Madam Chair. This bill was brought to me by the Georgia Board for Physician Workforce. The board voted to change their name because they're now responsible for some tax credits and scholarships for people beyond just physicians, dentists, and advanced practice providers. And so they asked to change their name to the Georgia Board of Healthcare Workforce, which was at least non-controversial on our side. There was also some discussion about the makeup of the board, since again they're handling issues that are not just specific to the physician workforce anymore. So the language between lines 22 through I guess 40 describes the membership of the board, and that's what's a little different in this committee sub than what passed the Senate. But I'm perfectly supportive of it. Madam Chair and I worked on that together. I won't list all of those, but just to say that there is a representative from dental community, PA, and nurse practitioner, as well as different types and diversity of physicians, and a member of the consumer group. So be glad to answer questions, Madam Chair.
You, now, I understand that when people come over to your side, Senator, our members are getting a real hard time and, getting the, 60 questions and more. Okay, so I'm going to give my members leeway to just ask you anything they want to. I'm really teasing you, Senator. Be nice to the senator. He's nice to us. He helped me with our anti-shackling bill, which is on tomorrow in Senate Health. So don't be too hard on him.
I helped several members of your committee this year as well, Madam Chair. I always try to. Well,
thank you for that. Okay, questions from the committee? Okay. Okay, hang on. We're not quite ready. Representative Dempsey.
Yes, thank you, Senator Burke. I just had one question, and it's about the appointments down on line 43. I believe it starts. All board members in office July 1 will stay to serve until the expiration of his or her term. So that means if there's, the governor cannot remove anyone that is serving at that time. Is that
I
right?
think the governor can remove people for cause, but I don't, other than that, they'll just roll off as their terms end,
Okay.
just to be non-disruptive. And
But if there was someone, like, for some reason, he felt there was someone who could serve better, he would still, even if they were serving on July 1st, 2019, he still has that authority to change.
That's my understanding.
Great, thank you.
Oh, Senator, who's going to be the House sponsor?
I
Me?
think you volunteered if I remember, but if
Senator-
not, I'll, you know.
Senator, things are so crazy on both sides of the aisle. Right now, I have trouble remembering my own name. Yes, I will be the House sponsor. Okay? Seeing no other questions, all right, it is now time for what the committee wants and a motion.
Move to pass. Second.
Got a motion to pass and a second. Is there further discussion? Any other questions by the committee? Okay, hearing and seeing no lights turn on. Everyone in favor of the passage of the substitute to Senate Bill 207, say aye. Aye. Anyone opposed? No. Okay, the ayes have it. Thank you very much.
Thank you.
And
Appreciate your
Senator Buck,
time.
thank you for the help for me and for our members. Okay, all right. Are you ready to go? You're ready to go? Okay, let's go with Senate Bill 168. Senate Bill 168. And let me, okay, we had a last minute change that came out, and I think we will be working, all right, on LC 33797-6S. Is that correct?
That's correct, Madam Chair. Thank you.
Okay. If you're ready, go ahead.
I'm ready. Thank you so much for hearing this bill today on behalf of Leader John Burns. He was called away and asked if I would fill in. So if we go through the bill on Section 1, this is the original language, and it simply updates the definitions for advanced practical nursing and registered nurses to include those individuals holding a multi-state license under the Nurse Licensure Compact. Further, this section allows the Board of Nursing to issue an advanced practice registered nurse APRN designation to a registered nurse who holds a multi-state license. This change will bring our law into conformity with the Compact's current rules. And then if you'll refer to Section 2, this section addresses concerns brought to our attention by Chairwoman Cooper regarding nurses practicing in Georgia using a multi-state license under the terms of the Compact. Specifically, this section simply requires that the Board of Nursing provide notice to healthcare providers and entities like hospitals employing nurses practicing under a multi-state license that should the nurse change their state of residence to Georgia, they are then required to apply for a single state Georgia nursing license. And then Section 3 contains the original language. This section relates to the licensed practical nurse, the LPN definitions. This is included for consistency within the bill for RN and LPN definitions. It does not change the requirements for LPN licensure nor LPN scope of practice. Section 4 is the original language, and this section simply clarifies the role of RN and LPN in mandatory reporting. This language does ensure that APRNs who are practicing in Georgia under the RN multi-state license are included in mandatory reporting, the same as all other nurses practicing in Georgia. Section 5 is again the original language. This section deletes language included in the original Compact legislation passed by the General Assembly that placed Georgia in non-compliance with the Compact's provisions. Essentially, this language inadvertently required nurses practicing under a multi-state license to meet more stringent requirements in Georgia than in other Compact states. Section 7, this section can be seen as the companion piece to Section 2 and specifically addresses concerns raised by the chairwoman. This section empowers the Department of Community Health to require health care providers and entities employing at least one nurse holding a multi-state license for at least 30 days in a calendar year to report to the Board of Community Health the name, address, and duration of employment of each such nurse. This information will then be provided to the Board of Nursing. There are two reasons behind this amendment. First, to ensure Georgia maintains an accurate record of the number of nurses practicing within our state under a multi-state license. And second, to ensure that should a nurse practicing in our state under a multi-state license choose to move here permanently, such nurse understands his or her requirements to apply to receive a Georgia single-state nursing license under the terms of the compact. And Madam Chair, that concludes my comments on the bill. I'm sure that you may have some things to add, and we have Calder Childs with us from Leader Burns' office.
Calder, do you want to add anything right at the moment?
No, she read the script perfectly.
Okay. Well, she sort of got it. She got this job at the last minute. Okay.
I did.
I will point out that the reason this is not unusual if the nurses stay and decide to live in the state where they have been practicing, to require that they get a state licensure, because that is then their home state, and that they meet the requirements of our state. If our state has higher requirements, they would have to meet our requirements. And the reason for keeping up with them, so that we know, who's practicing in our state. I want to point out Section 6 again for you. I talked about Clayton County trying to get care to more of their constituents, and Section 6 applies and makes it clear what those APRNs that are riding on the ambulances can do when they go out on the ambulances. And it also makes clear that we want them to help the people that they go out to see find a medical home, either with a private provider or at their federally qualified health center there. And if you know, the federally qualified health centers will see patients for free. If they don't have any money, they'll see them on a low sliding scale. They'll take Medicaid, they take Medicare, and the federally qualified health programs are having extremely good long-term outcomes when it, especially as it relates to diabetes and hypertension, which are two of the main problems that we see patients experiencing in Georgia. So we are trying to get our citizens to care. I have to brag a little bit on the federally qualified health programs. There are 225 locations across our state. They're in all of our regions, especially out in our rural areas, from north, south, east, and west. They have an easier time getting physicians than we often do, because there is a federal program that forgives their student loans of $200,000 and $300,000 much quicker than we can. And they also, the federal government covers any malpractice cost. So, an OB trying to set up practice, a regular OB trying to set up practice in Ocilla, Georgia, before a door was open or anybody hired, or, they saw one patient, his malpractice would be over $100,000. And that would be due every year, and it makes it very hard for a young doctor to meet their expenses and open their doors. And so the federally qualified health centers don't have that problem and can often get physicians. They're a full wraparound service, not just seeing you in the clinic, but with follow-up. And they are certainly, and I hope will be part of Georgia's expansion of care to our patients. They're doing a fantastic job. And I read recently that they were called out as being one of the big helpers of picking up the needs of citizens all over the United States. So I'm very proud of our federally qualified health programs. So that's my, I should work for them. I just gave you the big ad on them, but They are good. They also have them in the metro area, but they are predominantly more out in the rural areas. Okay, questions from the committee about the nurse compact changes? Representative Reinders.
Thank you, Madam Chair.
Thank you, Madam Chair, and thank you for presenting the bill on such short notice. A couple of years ago, we had a question as it related to in dentistry and where they made the referrals and actually hung their title. So I'm going to draw your attention to line 81 and 82 on page 3. That a patient shall be referred to a physician or federally qualified health center. Is there anything that would keep, at this point, this APRN from referring to someone who is a physician not located in Georgia? We had the same issue, you may recall, Madam Chair, when it came to the dentistry with the dental hygienist.
Betsy?
Yeah, in that chapter, physicians defined as one licensed in the state.
Thank you.
Good question, Representative Reinders.
I wouldn't want somebody to be referred to Tallahassee hypothetically.
Well,
So, thank you
you're
for the
right,
answer.
but I think the patients, I mean, you are correct to ask the question, and let's clarify the issue, but I think the patients that these APRNs are serving on the ambulances are elderly, can't travel well.
I understand. I was just trying to
Lori.
make sure that the nurses that wanted the license in Georgia was referring to Georgia physicians.
Got it.
Thank you.
Other questions from the committee? No questions from the committee? Okay, we do have several people signed up that want to speak on this bill. Let me go through Deb Bailey.
Good afternoon, Madam Chair, members of the committee. Deb Bailey, and I represent the Northeast Georgia Health System. We're a 4-hospital system in Northeast Georgia, and we're standing in support of this legislation. It will be very helpful to us as we look at the shortage of nurses in our area. So I hope you will consider.
Yeah. Deb, I have a question. How many do you usually have out-of-state nurses working at a time? And do you go through an agency to find them, or?
We do, and right now, as of today, we had 56.
Where were they from? I'm just curious.
Anywhere from Texas, South Carolina, North Carolina, all of the states surrounding us, not too much further than that.
How long do they usually stay?
Well, given that this is flu season and that we're on high occupancy in all of our areas, not usually over a month, but average is about 3 weeks.
Oh, okay. Thank you very much.
Thank you.
Julie Wyndham?
Thank you, Madam Chair, members of the committee. My name is Julie Wyndham. I represent Navicent Health. We are a 5-hospital system in Macon, Bibb, Monroe, Putnam, Peach, and Baldwin counties. We are very supportive of Senate Bill 168. We appreciate all the work that the chair's done on this, as well as the sponsors of the bill. We currently have 191 nurses practicing under the compact at this point. To put that in context, we have about 200 vacancies system-wide that we currently fill mostly with contract nurses working, because we don't have the full-time help for those positions, and that cost us, we think, about an additional $8 million a year. So if we had to fill these 191 slots with contract lobbyists, that would be with contract lobbyists. Sorry, with contract nurses. Sorry.
I don't I don't want any of the lobbyists taking care
I
of
know.
me.
I always tell people in my hospital, if you see me on the clinical floor, run. Something's wrong. Absolutely. But if we had to fill those slots with contract nurses, it would be a significant increase to our expenses. So we certainly appreciate your favorable consideration of this legislation.
Okay, thank you. Tim Keebler?
Tim Kibler with the Georgia Alliance of Community Hospitals. We very much support this legislation for the reasons Ms. Bailey and Ms. Wyndham have already espoused. Thank you for your favorable consideration.
Thank you. Okay, has anybody else come up with any questions? No. Okay, Representative Hawkins.
You know, noting that a lot of the emergencies that's seen are actually abscessed teeth. We've heard that from emergency rooms. This line 81, 82, would a dentist be considered an allowable referral by a nurse?
I think that, and I wouldn't have any problem with that. Is there anything that would? We can add that.
I mean, I don't want to slow anything up. I'm
No,
just thinking
It
that,
has to go back, the bill has to go back over to the other side for agreement or
Okay.
disagreement, so you won't be slowing anything out. So, Betsy, would you like to read how you want to make that amendment?
Yeah, sure, probably at the end of line 81, they shall be referred to a physician, comma, or a dentist as appropriate, comma, for a thoroughly qualified health center. Work.
All right, at the appropriate time, we'll make that. Representative Beverly,
Thank you, Madam Chair.
and I'm not gonna put optometrist on there either.
Then we're good. We're still good.
Not too many medical emergencies, although
Yeah, I
some.
hope not. Sometimes. But the question I have is really in the section 6, and I guess I'm not finding it in the code section, and maybe I could just go offline a little bit, but I want to draw your attention to, this is not the nurse protocol agreement. It's not in the next section. Is that right, Betsy? Because it goes up to 9 in OC 4330. What is it, 43, 34, 25? It goes up to 9, but I don't see a 10, which you're replacing in that code section.
There should be a 10 there, I don't know if that's an older version or not, but the language.
Gotcha.
Yeah, it was added
After the, yeah, okay. Okay, all right, thanks. Just
Got it.
wanted- yeah.
Okay, thank you for that. Okay, other questions? Okay, let's take it, I'll take a motion on the passage of the bill first, to the substitute to Senate Bill 168. Do I hear the motion? Okay, I've got a motion. Do I have a second? Okay, now, would you like to make your motion for an amendment? Representative Hawkins.
and I'd like to amend the line 81 at the end to say to a physician or a dentist or, and then 82, federally qualified health center.
Second.
Got a motion and a second. Any discussion? Everybody in favor of that, say aye. Aye. Anyone opposed, no. Okay, now we are back to the main bill. Okay, so we have a motion on the substitute to Senate Bill 168 as amended. I don't see any further lights going on, so everyone in favor of the substitute to Senate Bill 168 as amended, say aye. Anyone opposed? No. The ayes have it. Thank you very much. That's it. It's on its way, but will be soon, shortly back over to the Senate.
Thank you, Madam Chair and committee members.
Thank you. Okay, Representative Dempsey. Go ahead. Okay.
I'm back to revisit a resolution that we looked at as a joint House and Senate study committee right before crossover. It did not make it through. So I'm coming back to ask you to once again consider supporting just a House study committee on infant and toddler social and emotional health. As I told you, this will give us the opportunity for early diagnosis and looking into the fragile window of time that we have with some of our youngest children to help identify early and to help direct and redirect the course of our children who are at risk on the pathway of healthy development. Y'all did support it unanimously, and I would ask for you to consider that again.
Okay, there are questions for Representative Dempsey? No questions.
We do have, I know she was not able to sign up, but I understand that Callan Wells with Gears
She
is
got it?
here. Okay, just
Come
to
on, Callan.
speak.
Hello.
Hi.
Thank you, Madam Chair, for calling this meeting. I am very short. Members of the committee for allowing me to speak, and thank you to Representative Dempsey for introducing HR 421. My name is Callan Wells, and I am the Health Policy Manager for GEARS, the Georgia Early Education Alliance for Ready Students. Our mission is to support quality early learning and healthy development for all children birth to 5. and I'm here to speak on behalf of HR 421, the creation of a study committee on infant and toddler social and emotional health. Social and emotional health in this context is defined as the developing capacity of the child from birth to age 5 to experience, regulate, and express emotions, form close and secure interpersonal relationships, and explore the environment and learn, all in the context of family, community, and cultural expectations for young children. We believe that based on what we know about early brain development, studying infants and toddlers' social and emotional health is critical to ensuring every family's ability to build a strong foundation for early learning. Just under half of all children have experienced at least one ACE, or adverse childhood experience, and 1 in 10 children have experienced 3 or more. Young children who experience ACEs during early childhood are more likely to develop behavioral problems, social disorders, and learning disabilities throughout their lifetime. Preventative measures and early interventions to mitigate these lifelong outcomes could prove incredibly powerful for our state long term. Until now, the needs of infants and toddlers have not received dedicated focus during study efforts on child mental health. Since the systems that serve infants and toddlers in Georgia are often distinct from those that serve older children and adults, we believe that time is needed to examine opportunities to better address the needs of this population. Again, I thank you for the opportunity to speak with you on behalf of Georgia's youngest learners, and I'm happy to answer any questions you have.
Don't think we have any questions. Thank you
Thank
very
you.
much. Okay, we're back to the resolution. What's the will of the committee? Okay, I've got a do-pass. Do I hear a second? I got a do-pass and lots of seconds. Okay, so any other discussion? Okay, everyone in the favor of the passage of House Resolution 421, say aye. Aye. Anyone opposed, no? Okay, the ayes have it. Thank you,
Thank you.
Representative Dempsey. Okay, I told you that we have a special guest, Jamie Schomburg. You want to come up, and Jamie? While you're coming up, before you tell us your story, and Dr. McFadden, do you want to also come with Jamie? I don't know about y'all, but I've been getting lots of people talking to me about vaccines. Pro, but a lot of people against vaccines. And I certainly respect people having differences of opinions, but I had an interesting experience. I had a group of people come and, we have a vaccine injury, the feds have a vaccine injury fund. And they came to me asking me to help, maybe move a bill that would make people more aware of that. If they feel like they've been injured, if the injection, did something to their shoulder or some way. When the bill came back, it was basically a total annihilation of vaccines for children. I mean, even if they could accuse a physician of being overly persuasive to try to get people to use vaccines, and they could then report them to their medical board for censorship. And somehow I think we need to have a balance in this. And so as this came up, I decided, and as we've been talking and trying to get the Board of Education, and it's through public health, to finally do what they're supposed to do. Almost 2 years ago, the Board of Public Health was supposed to, in conjunction with the Board of Education, was supposed to agree on a letter that would go out to our high schools so that they could remind people that students between the 11th and 12th grade needed to get a booster for meningitis on their meningitis vaccine. To this day, the letter has not gone out, even though apparently it was agreed upon, and it was as simple as getting out to our high schools across our state. One injection is not enough. You need that booster before you go off to college, where you are often with groups of people smoking and drinking and not getting enough sleep, and where we have a problem, a high incidence, and that also happens in high school. So as that happened, and we were talking about the meningitis, somebody told me about Jamie. and said, I think we can get her here from Texas. And being a Texan, you know, I thought, great. So, Jamie, you're on now. You tell us your story and about vaccines and what you
course.
do now.
Yes, thank you for letting me speak to you. My name is Jamie, and I got meningitis when I was 20 years old. Like many of us in this room, I did not know anything about meningitis. I knew that there was a vaccine out there. I didn't know what it could do, and unfortunately, I had to learn the hard way of what meningitis was. So I'm 30 years old right now, and when I was 20 is when I got meningitis. I'm the youngest of 4, and like everybody, all of my siblings, they all went to UT, so it was my turn. So I also went to UT, and just to clarify, UT Texas. I wanted to enjoy my experience and to, be, invincible. This is the first time where we're not living at our parents' house and we are making our own sleep schedule and our studying schedule. And you don't really think about how we need to be actually also protecting ourselves from what's out there. We just don't think about it until it's in your face. So I actually got transferred to UT my second year of college, and unfortunately I wasn't able to enjoy a full semester without contracting the disease. When you're on college campus, you're even at a higher risk of catching it, and I didn't even know that, and I almost died. I had a 20% chance of survival. When my first symptom was, I don't feel good, nauseous, maybe headache. I mean, who hasn't felt that today? So the first early symptoms are very misleading sometimes. But then for me, it got worse. I was at my friend's place and I spent the night because I didn't feel well. And, there was something different. When I would go to the bathroom to relieve myself, I noticed that my hands were sensitive to flushing the toilet. My hands were sensitive to washing my hands. My feet hurt when it touched the tile. But of course, I'm not thinking, oh, this is meningitis. I'm like, oh yeah, of course, I've heard about this. That's the thing. And so that morning, I went to my apartment, and it was a beautiful day, and I felt like garbage. I wasn't walking like people walk, like 1, 2, 3, 4. I'm struggling for one step. I'm holding myself up against the walls. I'm shivering down to my bones. This is all within 14 hours. I stopped going to the kitchen fridge for water because the kitchen sink was closer. I stopped going to the kitchen sink because the bathroom sink was closer. I would just put my head under the faucet. And luckily, my sister called and offered me a ride to school, which has never happened in our relationship of sisterhood. And it was a blessing that she did, because if she didn't, I don't know what could have happened. Obviously, worst case scenario, I could have not survived. And that's the thing about meningitis. It's a very fast-acting killing disease, can typically kill within 24 to 48 hours. And I was admitted within 14 hours and didn't leave the hospital for 7 months. Not what college students should be experiencing. Instead of learning, chemistry, I was learning what my life was going to be like, what it's going to be like with prosthetics. And when I say I'm in the hospital for 7 months, I'm not like getting up and walking around. I felt like a statue in bed. I couldn't lift my arms over my head for 3 months. I couldn't sit up on my own until I was leaving the hospital. When my hands touched, it didn't sound like soft hands, it sounded like metal hitting metal. And all within a couple of days, you saw my limbs go from red rash to purple to black to literally rotting. If you lifted the blankets off of me, it smelled like a dead body. And that was normal for us. Bedside wound care, surgery, wound care, and then eventually I had my amputations. Needless to say, it was a very difficult experience. But I did get out. Recovery did take some time. I would say 3 months to work with prosthetics. But, for me, I live in Austin. Austin's a big music town, and I like to enjoy concerts. And that's, the little things in life that can be taken away. You just really want to get it back. So it took me about a year just to get back into the life that I had. I was a student. Luckily, the university was very okay with me taking time off and gave me extra time to finish my classes. But my hands were bandaged up for months. My brain cells were going down because I was filled with antibiotics. And it was a sad normal that became our lives. And then eventually I started asking myself, you know, why? Why did this happen to me? And then I started seeing other people getting meningitis, and I go, why does this have to keep happening to others? So my family and I, we dedicated our lives to educate and advocate for meningitis awareness. Like many people in this room and myself, I didn't know anything about it, so education is just so important to me. So having something like this with a resolution, it's just would be so impactful for people to have an opportunity to get educated, and most importantly, talk to your doctor. Students that are going to school, college, so important. When you're in dorms, you're at a higher risk of catching it. I lived off campus and alone and still almost died from this disease. 1 out of 10 that do get meningitis will die. And those who survive, 1 out of 5, will have long-term consequences like myself. I have prosthetic care, so I will be dealing with that for the rest of my life, and it's a hefty penny. But nonetheless, there could be brain damage, you can have blindness, become deaf, you can have internal organ failures, severe scarring, more amputations, and obviously you could die. And I've definitely met other parents without their survivors, and that's very difficult too to see. But nonetheless, there's been a lot of outbreaks about meningitis, and it's an opportunity for everyone to get educated about it, see what they can do to protect themselves and their community, their families that are around them by being vaccinated. So with that being said, are there questions?
Well, I think you left out something about
Yeah,
you. Haven't
sometimes
you
that
won
happens.
some,
Yes.
had
so,
some special honors now that you've conquered
Yes.
this disability?
Yes. So in Texas, we did pass a law, and it was amended in 2011 because the original law was for only dorms and Greek houses. And as I mentioned, I lived off campus, so we amended it in 2011 for all college students entering Texas schools are getting vaccinated. There was another boy that passed. He was declared brain dead within 18 hours of his first symptom. And so it's called the Jamie Shambaum and Nicholas Williams Act, and I hold it very dear to my heart, and so with his family too. But then there were other successes. When you're in the hospital, who's been in the hospital for like a week? It's not fun. So to be in there for months, you kind of lose it a little bit. And so I wasn't thinking about how I'm going to be active. I was thinking about how am I going to meet people, something as simple as that. And then there was someone who came into my room, and he was missing one arm, and he was actually my occupational therapist, which is very impressive for an occupational therapist to have one arm. And he's telling me about cycling. He's like, we're gonna get you on the team. And I looked at my mom, was like, get this guy out of here. But he was right. He was on the U.S. Paralympic cycling team, and he introduced me to the right people. And within a couple of months, I was at the Livestrong Challenge, did 12 miles with Lance Armstrong and a couple other 1,000 people. And then a couple months after that, I was meeting this guy. He's asking me questions about my bike and how it's adapted. And to answer that, so your bike, right, your handle, your brakes, your fingers brake, right? So my brakes are actually flipped on my side, and I push into it. That's the only difference between my bike and anyone else's bike. And he's asking me these questions because he was actually a U.S. Paralympic cycling coach. And he was wondering how I would qualify or be categorized, and it's very political in the Paralympics, by the way. And before I knew it, he asked if I wanted to be on the Paralympic team, and I competed in road nationals and won gold in my division. And then I was on the team for the Pan American Games in 2011, and no medals there, a lot of personal records though. But it was amazing to be with the team, so much Nike sponsorship, red, white, and blue. And 3 years prior, I was fighting for my life. So I'm very honored that I got to have this crazy, wonderful experience, and life has really prevailed. I just got married like a year ago. I travel all the time, and I feel very lucky to be in the situation that I am in. And when people are in the situation, like almost losing their life, sometimes people don't want to speak up, and I'm just happy to do that for the people who aren't willing and wanting to. I know it's difficult. You guys are intimidating, I gotta say. But nonetheless, it's so important just to get the voice out there and to share the story, and I'm just happy to present in other states as well. So thank you for letting me ramble for a little while.
Well, Jamie, I think we're the ones that are honored, and all the other states and all the other people that hear you make the presentation, First, to educate about the need for vaccines, and secondly, to be a role model for people that have disabilities. Life is not easy when you have all your your legs and your toes and your arms. It's difficult at times, and to have a disability and to overcome it and let other people see that have disability is extremely, extremely important to others. So thank you for doing that. Do we have questions for Jamie? If not, we'll let Dr. McFadden just give us a little bit about vaccines in general and the need for them and whatever she'd like to say. So thank you for coming, Dr. McFadden.
Thank you so much. Good afternoon, Chairman Cooper and members of the committee. I'm honored to share this table with Jamie. That's quite a story. And I'm not quite as eloquent as she is, so I've jotted down a few notes if you'll indulge me. I'm Dr. Terry McFadden. I'm a general pediatrician, and I've been in practice for about 25 years and have trained some of the next generation of pediatricians during that time as well. I'm here today to discuss the importance of immunizations for the health of Georgia's infants, children, and adolescents. And it may seem odd that such a reminder is even needed in 2019, but unfortunately, this type of testimony is increasingly more important. So on behalf of the Georgia chapter of the American Academy of Pediatrics, I thank you very much for the opportunity to discuss this important topic. First of all, it has to be emphasized that routine childhood immunization is one of the greatest achievements in public health over the past century. Vaccines prevent viral and bacterial infections that previously caused serious illness and death. In a recent article in the New England Journal of Medicine, a study estimated that childhood vaccination programs have prevented 103.1 million cases of diphtheria, hepatitis A, measles, mumps, pertussis, polio, and rubella since 1924. Another study in the Archives of Pediatric and Adolescent Medicine estimated that for every dollar spent in the U.S., vaccination programs save more than $5 in direct cost and $11 in additional cost to society. So that's a 16-to-1 return. However, challenges remain, in large measure perhaps because vaccines have been so effective. Unfortunately, we say that vaccines have been a victim of their own success. As we increasingly move towards eradication of diseases that we commonly immunize against, they're much less visible to the public, and as a result, the illnesses really aren't considered to be significant, sort of out of sight, out of mind, if you will. With lower immunization rates, there's no herd immunity. And herd immunity, if you haven't heard of it, is a form of indirect protection for infectious disease that occurs when large percentages of a population have become immune to the infection, vis-a-vis vaccines, thereby providing a measure of protection for individuals who are not immune. Herd immunity allows for babies who are too young to receive vaccines or children who are immunocompromised due to illness or therapy, for instance, cancer therapy, treatment, so that they can also have some degree of protection even though they haven't and cannot be immunized. And so when we reach a level of 90 to 95% of our community being immunized, we have herd immunity, which protects the least of these, if you will. So a decision not to immunize is not only a decision for that one child, but for the entire community. In the past several years, in many parts of the country, outbreaks of measles, pertussis, Haemophilus, and other vaccine-preventable diseases are returning, and you've probably heard about them. Most recently, in Washington State, there were 73 cases of measles reported in the recent months. Numerous factors, including the cost of acquiring and administering vaccines, and increasingly a complex delivery system, as well as a small but growing and very vocal number of parents who are foregoing vaccination for their children, put this success in jeopardy. It's this last problem, referred to as vaccine hesitancy, which has been linked to several of these latest outbreaks. I am old enough to recount to my pediatric residents, the back in the day stories, right? So fortunately, my current residents see very few of these diseases that we're talking about, but I can remember the large number of babies who developed bacterial meningitis with consequent hospitalization, brain damage, hearing loss, and sometimes death. I also saw children who could barely breathe due to the swelling of their epiglottis from Haemophilus infection. I saw babies and children who developed pneumonia or the flesh-eating bacterial infection of their skin after varicella, which is chickenpox. And I saw young babies who coughed so much from pertussis, known as whooping cough, that they stopped breathing. They actually stopped breathing. Some of them died, some of them had to be on a ventilator. But further, until recently, I had only seen a handful of measles cases, if you can believe that, because we had almost virtually eradicated measles. My most significant memory, however, is probably one that some of you remember too, and that is to be standing in line as a very young child, a line that wrapped around the building, holding hands with my mom, waiting to receive the life-saving polio virus on a sugar cube. I don't know if any of you remember that. That's one of those distant memories that I had to to really search for. But my parents and my community had seen the ravages of polio, and they were anxious to ensure that I was protected. So the American Academy of Pediatrics has long supported preventive care, including immunizations in the medical home setting, as a major component of pediatric health care and disease prevention. And further, the AAP believes that economic barriers should not restrict access to immunizations or other forms of preventive care for children. The AAP works to educate the public and key decision makers, such as yourselves, about the importance of routine child immunization. And lately, we've devoted more resources and attention to actively encounter misinformation about vaccine safety and efficacy. In summary, immunizations have been one of the greatest advances in medical science, which have saved countless lives and reduced illness among children. And requiring them for school entry, as all 50 states have done for decades, has ensured the safety of millions of these children. But we must remain vigilant. The anti-vaccine movement is real and unfortunately has been easily fueled by the pervasiveness of social media, where I tell my residents anybody with a smartphone is an expert now, where falsehoods and phony claims can masquerade as truth or alternative science. Thank you so much for the opportunity to speak with you today.
Well, Dr. McFadden, I can not only remember the sugar cubes, as a nursing student, I remember 3 people still in iron lungs. And, you know, when only their head is out of this big, huge cylinder and basically causing them to be able to breathe. And one person had been there since they were about 9 or 10, and they were in their early 20s at the time from the polio vaccine. So this is something that's very special to me. Questions from the committee? Do you have questions? Okay. We have questions? Okay. Representative Chokas.
Thank you. Thank you very much. We appreciate your bravery. Thank you for championing the cause. It's a difficult situation that you've been placed with, but you're making an extreme positive, and we're grateful for that. And this anti-vaccine movement, I've just been reading about it recently, and I'm shocked that it even exists. I traveled extensively throughout the world, and before you leave, you're required to take different shocks. I've had cholera vaccines and shocks before I went out of the country and so forth. What can we do as a state to encourage our parents to make sure that these immunizations are taken, encourage our universities to inform the student population of the dangers? In Americus, Georgia, where I live, at Georgia Southwestern State University, just 2 or 3 years ago, we had someone that died from meningitis. So I'm very much aware of the dangers. But what more can we do to ensure the health of our citizens?
Of course, education wherever it can be held. I also have a nonprofit organization where I deliver educational tools where it's just sheets of paper and they put it on the back of the wall, because that's what we do when we're waiting for our doctors. We look at the walls. And celebrities are obviously really big impacts. Social media definitely has a strong influence for sure. But the doctor's conversation in your doctor's office is so important. What I always suggest is for people just to talk to their doctors about what vaccines are available, how they can protect themselves, and just to clarify, there are 2 different vaccines that cover the 5 strains. So make sure you ask about both of them. So other than that, do you have input?
Just a comment that all parents want what's best for their children. And so, I think it's important to take a step back and say, what is it that they're trying to accomplish? What are they afraid of? And there's so much information out there, most of it pseudoscience or not even science at all, that I think parents feel like they're bombarded with information. It's hard for them to know what to trust and what message to trust. So I think, having a unified message where we are talking about the safety of vaccines, we're talking about the science behind them, and we're talking about how they save lives, and then listening to families who have these concerns so that we can hopefully hear what it is that is so troublesome to them so that we can combat that.
May I have a follow-up? Sure. Thank you. Two comments that I want to make. Number one is my father's best friend in high school had polio. And growing up and seeing him and him struggle and so forth, so I'm aware of the devastating effects. The second thing that I find ironic is that we export to underdeveloped and developing nations our vaccinations and public health policy and encourage other countries to follow the example of this country, yet we, apparently in today's society, are going backwards. So I just want to thank you both for your courage and what you do. And Madam Chairman, I appreciate you bringing this to our attention.
Now, I don't want anybody to get a big head and think that they're a celebrity on this committee. But sometimes people do listen to us, and if we use our social media as a way to educate, I think that the Voices for Children just gave you a handout that has great information on it, that you could do some beeps, bleeps, whatever you do on social media. Somebody does that, puts it out for me. I write it or whatever I want to go on it, but then they do the mechanics of getting out across the airwaves. So I think that in that way, or at meetings, we can also, put a face to it that we think it's necessary. Dr. McFadden, thank you for being a pediatrician in our state and taking care of our children. And before I dismiss everybody, Janie, the legislature declared April 24th as Meningococcus B Awareness Day. It's going to here at the state capitol. And I want to give you the copy of the proclamation for you to take home, since you traveled all the way from Texas to be with us. So I will have this for you. Let me come down there and give it to you. And we have somebody too that is a survivor and has worked hard to get over his disabilities, and Howard is doing from being very, very sick and having both legs partially amputated to being back with us again, trying to run over us with his scooter.